To other news now, and there's been a spike in the number of scarlet fever cases reported in our area. Nearly 40 new cases were recorded in the last week. Symptoms include a rash, headache and sore throat, and it's spread by kids coughing and spluttering. The highly contagious infection doesn't have a vaccine, but a doctor from Public Health England says it's just that time of year.
Well, we don't really have an outbreak, but what happens in the early spring, late winter months is that people are indoors, and because they're indoors, it's more communicable, so it's very infectious. So little children especially get this infection. It is aerosol spread, which means when they cough and splutter and they have a lot of mucus secretions, they can infect others. It is an infection caused by a bacteria. The bacteria's name is Group A Streptococcus, and this bacteria often resides at the back of the throat doing nothing, and then sometimes for reasons that we don't really understand it may cause disease and an infection, and so it will present as an infection of a sore throat, temperature, generally feeling unwell, and the reason why we call it scarlet fever is after the infection has progressed for a few days, you can get what we call a strawberry tongue, which is a red, raw surface to the tongue, hence the name scarlet fever. You can also get a generalized body rash, and we have very good antibiotics to manage this infection, but the antibiotics should be taken for the full course of the course, which is 10 days. Often people will start to feel very good within a day and often stop antibiotics, which is a wrong thing to do.
A man is critically ill in Southmead after being hit by a car on the M32.